Hi, my name is Dr. Max Greenlee. I wanted to give everybody a quick update about the 2019 coronavirus. There are a few things that I think that people should know as they watch the news and the updates about the coronavirus in the coming weeks. Let's start with a little background on the virus. Coronavirus are a large family of viruses that are common amongst camels, cattle, cats, and bats. The coronavirus is a respiratory virus, and this 2019 coronavirus has a name of 2019-nCoV. The 2019 coronavirus is a beta coronavirus similar to MERS or SARS that originate in bats. The current strain of the coronavirus was first detected in Wuhan City, China. Early on in the virus spread, there was a link to a seafood and live animal market. This suggested an animal-to-person spread of the virus, which is pretty uncommon. And as time went on with the virus, they noticed that people that hadn't been in contact with this live animal market were also coming down with the virus, denoting that there was a possible person-to-person spread of the virus. The coronavirus has since spread to many countries around the world. It has made a breach into the United States with its first person-to-person spread of the disease in January 30th, 2020. According to the CDC, the infection in the United States is very similar to that in China, denoting that it came from the same source. When dealing with a spreading virus, there are three things that you really need to keep your eyes out for. Number one is how the virus is spreading. We've already went over the initial spread of the virus, but what we want to keep our eyes on is how the virus continues to spread over time. Viruses can change, mutate, and shift direction without much notice. So the spread of the virus, though it's moderately understood now, could be completely different a few days from now. Second, and equally important, is the severity of illness caused by the virus. According to the CDC, the severity of illness from the coronavirus is not completely understood yet. Cases of the coronavirus so far have had a large range of effects on people, from mild to extremely severe illness and many deaths. The CDC has had an ongoing investigation to discover more about how illness progresses with this virus. According to the CDC, this is a rapid evolving situation. Changes may come, but the CDC is doing constant research to learn as much as they can. I'm going to put a link below to the CDC website where you can get trusted information if you need updates right now. The third thing you need to know is what to do if you or a family member come down with the coronavirus. If you're diagnosed with the coronavirus, your doctor or public health agent will denote whether you can be treated at home or must stay in the hospital. If it has been determined that you can be isolated at home, then you'll be monitored by your local or state health department. If you've been diagnosed with the coronavirus, it is very important that you monitor your symptoms. You want to keep a special eye out for severe symptoms such as trouble breathing. And if you experience these symptoms, you want to seek immediate help. On your way to your medical appointment, you're going to want to call in advance and let the medical staff know that you've been diagnosed with the coronavirus or you have a pending diagnosis for the coronavirus. That way the medical staff at the facility that you're going to be seeing is going to be prepared for your arrival. If you've been diagnosed with the coronavirus, you're going to want to prevent that spread to your family members. You're going to want to avoid sharing utensils such as knives, forks, spoons, and cups. You're also going to want to minimize close contact with your family members. You don't want to spread the disease to them, especially if they're very young or very old. These people are most susceptible to the worst effects of all viruses, including the 2019 coronavirus. As a healthcare professional, I recommend following the advice and recommendations of the CDC strictly. The CDC and the World Health Organization are going to have the most up-to-date and accurate information in regards to this viral spread, and that's where you're going to want to be getting your news from. The CDC believes that the current risk of the 2019 coronavirus to American public is moderate. However, they want us to do our best to help. It is current flu and respiratory disease season here in the United States. CDC suggests that you get vaccinated for the flu to prevent the flu. It also suggests that you do your best to prevent the spread of germs in general. Make sure that you always wash your hands, and when you cough or sneeze, make sure to cover your mouth. The CDC also recommends that if you're a healthcare professional, that you keep your eye out for flu-like symptoms in combination with recent travel to China. And for frequent travelers, make sure you stay up to date on all CDC travel notifications on the virus. I personally definitely fall into this case because I'll be going to Beijing, China in a couple weeks, and I'll be paying attention to everything that comes out by the CDC about the coronavirus and also following the World Health Organization. What to expect over the coming days and weeks? The CDC is expecting many more cases of the coronavirus to show up in the United States over the coming days. And as I said earlier, this is an evolving virus, it's a delicate situation, and it's ever changing. You're going to want to stay up to date on everything that's going on through all the appropriate authorities and pay attention to keep yourself and your family safe. I just wanted to give everybody that brief update on the 2019 coronavirus so you can keep track of what's going on and understand where to find the accurate information. Like I said, description below has got links to the CDC and the World Health Organization, and the information that they're putting out on the coronavirus is going to be the most accurate. Once again, my name is Dr. Max Greenlee, and I'm going to be following this coronavirus very closely, seeing as how I'm going to China in the next couple days. So if you'd like for me to do an update video in the coming days, put it in the comments below. I don't mind doing an update because I'm going to be up to date on it myself. And if you'd like to hear future health information, subscribe. I put out health-related content every week and sometimes multiple times a week. Thank you so much for your time. I wish everyone well. Stay safe, stay healthy, and I'll see you next week.